Pathological bow legs and knock knees. Now, genu varum is also very common, especially the parents have a concern that our child has bowed legs. Now, as I told you, it's usually physiological up till 2 years of age. Sometimes what happens is parents are concerned and they bring their 1 year or 1.5 year old child. That doctor, his or her legs are actually bowed. But usually at this age, it could be simply physiological. If it persists beyond 3 or 4 years of age, then that is actually a stage where you have to differentiate from pathological and physiological genu varum. Therefore, what you have to remember is that what are the differentials which comes to them if the child of this, which is about 7, 8 years or 10 years of age, comes to you with the bowed legs. There are certain things which you need to first assess. That is, you have to get detailed clinical history as well as examination as well. First assess whether is it unilateral or is it bilateral. Then what are the other differentials which does come to your mind is could be most commonly it could be Brown's disease, which usually it could be if its patient is coming with the age of, let's say, 7, 8, 9 and even 10 years of age. Then most likely it could be adolescent Brown, which is quite less common as compared to infantile Browns. But then the rickets, it could be skeletal dysplasias, or it could be osteogenesis imperfecta. All these things should be coming to your mind. But if it's a unilateral, you have to rule out history of trauma to the knee as well as the physeal damage which could have occurred for any other secondary to trauma. Therefore, when you're dealing with genu varum, these are the certain differentials you have to keep in mind. That is the Blount's, rickets, osteogenesis imperfecta, skeletal dysplasias, trauma, and physeal damage. Then you have to also, for example, if a child this of African American race, this comes to you with this is classical example of a unilateral genu varum. Now, if this is come, you have to dig out the history, what actually happened to this knee. Was there any history of fall? Was there any history of trauma? Was there anything wrong with this? Because if it's affecting only one knee, most likely it will be pathological genu varum due to trauma or physeal damage rather than any systematic problem which could be affecting, we would be more surely affect the both knees. If this child comes to you, as obesity is one of the risk factors, especially in the case of adolescent in Blount's disease as well, because of the mechanical overloading, the patient may develop genu varum. And in this, you have to rule out other causes as well. Sometimes, for example, because this sort of an obese child may have also issues with the hip as well as the ankle joint as well. Therefore, when you are dealing with the knees of these children, you have to assess hip as well as the ankle and get detailed knee history and examination to rule out other associated problems such as osteogenesis imperfecta, skeletal dysplasias, and rickets as well.